Hi, my name is Mercedes Harwood, and for my portfolio presentation, I will be discussing the opioid epidemic in Nebraska. So I chose this issue because people are dying at alarming rates. Addiction is plaguing the nation and Nebraska. It's so important as a future healthcare worker to have these discussions, to be educated, and to become a change agent for a hospital that I work with and the community here in Nebraska. Um, I believe it's important to focus on holistic medication or holistic therapies and non pharmacological therapies into patients' care plans. My personal connection to this issue stems from working with patients over the years who are fighting with opioid addiction and also family members fighting those same addictions. So, a little background on why this is so important. The Department of Health and Human Services declared the opioid epidemic a public health emergency in 2017, which is fairly recently. The National Drug Institute on Drug Abuse reports opioids were involved in 70% of all overdose deaths. In 2018, there were 48.3 deaths involving opioids in Nebraska. And this is so important for future nurses, nurses now, anyone in the healthcare field, because we are on the front line of this epidemic. So for my first educated citizen category, effective communication, my first experience was with a patient who was a 54-year-old female who came into the hospital, suspected C. diff. She came in and she had a lot of nausea, vomiting, diarrhea. Turned out she didn't have C. diff, but she had a very stressful life event that was causing these other kind of symptoms. So we talked with her. She had recently lost both of her parents and wasn't in contact with the rest of her family. So the patient was very stressed, very anxious, and we had administered her prescribed dose of anti-anxiety medication and her PRN anti-anxiety medication. And then she was still having a lot of anxiety and was asking for more. Well, she still had a few hours before she could have any more. So instead of just telling her that and leaving it at that, me and the nurse decided to sit down with the patient and actually talk about what was going on, why she was having so much anxiety, why she was so stressed out. And we ended up being in there for 45 minutes. We had the time to spare to do that. And the patient reported feeling less anxious after talking with us. She said it was so important to feel like someone was listening to her, and that's what me and the nurse provided. And this is just something that I can bring in my nursing career with my communication skills to take a moment and have these discussions with patients as the nurse and be present and take a non-pharmacologic approach to the healthcare setting. So my second example is a patient I took care of in Nursing 210. She was asking for a lot of pain medication. She was suspected of having addiction. And at the time, I didn't know much about how to go about this. So I used my communication skills to talk with the nurse and the instructor about the situation and learn everything that I could. And, they sat down with me and talked about pain is what the patient says it is. And just because someone's addicted doesn't mean that they're not having pain. And it really opened my eyes and showed me that communication is key. You're not going to learn if you don't ask. And having these discussions helps further my education and my care that I'll bring to other patients. So the next category, reflective individual. My first experience was another patient who was very anxious and depressed from being hospitalized. And I was doing everything that I could, but she was just still having a lot of anxiety. So I cleaned her room, rearranged it, helped clean her up, um, organized everything in the room, and she felt so much cleaner and so much more clarity after that. And it just reinforced the idea of making a healing environment for my patients. And that can be and should be incorporated into every patient's care plan. Um, and I will continue to do this and encourage my peers to practice this and take that extra moment to clean up the room and help these patients get more clarity instead of just, asking for more anti-anxiety medication. We can use non-pharmacologic approaches to help these patients. My second experience was on my oncology rotation. A patient was experiencing a lot of nausea and vomiting, and the medications were helping her a little bit. Um, so I sat down with the patient and with the nurse, and we reevaluated the patient's care plan to incorporate some non-pharmacologic management strategies. So we listened to audiobooks and online guided imagery, and this helped distract my patient and feel less stress and anxiety, which in turn helped her nausea and vomiting and kind of upset stomach. So here I displayed my reflection skills after learning about holistic therapies, non-pharmacological therapies, just like basic patient care. And I was able to bring that to my patient and revise her care plan. By applying these different interventions, you can help the patient heal their entire self. It's not just healing signs and symptoms with medications, but healing the mind and putting the mind at ease, because healing a patient's mind helps heal the body, and it's looking at the patient as a whole. So for becoming a change agent, my first experience, I had a patient who was having trouble weaning off Dilaudid. And as you know, you can't leave the hospital on Dilaudid. The goal is to wean patients off so they can get discharged from the hospital. And my patient was having trouble weaning off the medication, which was keeping her hospitalized longer. So I was able to also sit down with her and the nurse and help the patient try new non-pharmacological therapies to control her pain, like heating pads, distraction, like the guided imagery, um, ice, anything to kind of ease that pain. And what I learned here is educating patients and using these alternative therapies can help manage pain. And we need to take more time instead of just educating patients on, opioid addiction is very serious and it can happen if we continue these drugs, but teaching them about the alternative therapies that they can do so we can move away from those opioid medications. And I think that should start at admission. And as a change agent, I want to keep devoting my time to changing how we manage pain, changing how we educate patients about pain control. My second experience, or overall experience, was just throughout my time at Methodist College. I had been studying the opioid epidemic I've been studying patient care. I've been studying pain management. I had studied alternative therapies, holistic medicine, and this really encouraged me to start making changes in the way that I provide care and hopefully help others make changes in how they provide care. So I want to continue to educate my peers on the opioid epidemic and change the way people see pain control. And I want to continue being a change agent when I start working as a nurse and join committees and really start educating and getting pain managed in alternative ways. So I believe education is the best way we can do this, and that goes for educating providers, nurses, all hospital staff on the importance of non-pharmacologic pain management. And one area I think needs would benefit from a lot of education is how we educate patients. Giving patients outlines on opioid addiction is very helpful, but I don't see a lot of education on non pharmacologic therapies, on holistic medicine that we can give the patient for them to try at home. And then they can take that home and reference it. And I really just hope to continue this throughout my nursing career and keep providing education and keep researching myself and reflecting on ways that we've done things, ways we can change managing pain, and how to effectively communicate that to the community, to the acute care setting, and to my peers. And here are my resources. Thank you.